So I'm very excited at this meeting to share the results of the MILESTONE clinical trial. MILESTONE stands for measurable residual disease, or MRD-guided adapted, of transplantation in the setting of dysproteinemias. And this is a phase 2 investigator-initiated single-center study which was performed at University of Alabama. We were delighted to share the results at the meeting. This is a small pilot feasibility study to understand whether we can use real-time MRD assessment to make decisions about transplant. MRD has been recently favorably reviewed by the ODAC as an early endpoint for accelerated approval of novel therapies, and based on this information really provides us with a novel opportunity to sort of test this to make real-time decisions. We know that autologous transplant for years has been a prime consolidative strategy in myeloma, but it's not without the short as well as long-term toxicities. And now, in the era of quadruplets with deep responses, we really, for the first time, have an opportunity to sort of find patients who have that sort of depth of response early on that we can use the post-induction MRD test to make the decision. So the MILESTONE study was hoping to use the post-induction MRD to make the decision regarding transplant. So what we did was we have 20 patients on the study. We have 50% of those patients older than the age of 70, 50% are male. We have 15% high-risk patients. And in this subset, we see that the post-induction MRD rate by next-generation sequencing using the clonoSEQ assay was 25%, increasing to 55% after consolidation, and then the best MRD response in our study was 65%. We also show an overall response rate using IMWG criteria that's 100% post-induction and post-transplant, as well as CR or better rates that were 35, 75, and 85 in terms of post-induction, post-consolidation, and best response. So what we have shown on the MILESTONE trial is that we can utilize a real-time MRD test to make decisions for transplant and still have equivalent outcomes as quadruplets plus transplant and spare about 25% of the patients the toxicity associated with transplant.